Hello, hello. This lesson is about unprofessional conduct. So basically how to deal when it comes to your attention that a therapist is acting unethically or illegally, or perhaps when you are. So that's what we'll be talking about here. Okay, the learning objectives. First off, to address issues regarding suspected unethical behavior of colleagues, so others that you're working with. Second, to describe the concept of malpractice. Third, to address issues regarding sexual misconduct. And lastly, to examine the basis for malpractice liability in therapy. So we'll start with colleague misconduct. So colleague misconduct basically has to do with you having suspicions or knowing that a colleague is engaging in behavior that could be unethical or illegal in their capacity as a therapist. Generally, the best way to proceed in these situations when you're having concerns about the behavior of a colleague is to deal directly with the colleague, unless doing so would compromise a client's confidentiality. So what the BBS wants us to do is that in these cases, they want us first to try discussing it with the colleague directly. If for some reason that doesn't work or you're uncomfortable doing that, you could then discuss it with the supervisor, your supervisor or theirs. If the situation isn't going to resolve through these measures, you're encouraged, but not required, to report unprofessional, incompetent, or unethical conduct to the ethical board. Okay. So if you were to see an exam question about colleague misconduct and there's an option of discussing it with the colleague, that's usually going to be what you want to select because they want you to go to the least restrictive approach, and then to the supervisor, and then potentially, if you want to, you can report it. Now, in the case of more egregious offenses like sexual exploitation of a client or general incompetence, informal measures like talking to the colleague or the supervisor are very likely not going to be enough, and you would potentially be looking at more reporting as more of an option. Okay, what is malpractice? So malpractice means bad practice. And it's a legal concept that involves alleged negligence that resulted in an injury or loss to the client. The primary focus of a negligence suit lies in determining what standard of care to apply in deciding whether there was a breach of duty to the client. So basically what that means is, has your action as the therapist deviated from the accepted standard of care that all therapists should engage in? And has it directly caused harm to the client? Okay. So there's more, it's not just, oh, you did something wrong, right? But it's that your action is different from what is normally accepted and it potentially caused harm to the client. And so here's an example with suicide. So in the case of suicide, two factors determine your liability as the therapist. Those are foreseeability and reasonable care. So foreseeability involves assessing the level of risk. So this is what would be within the standard of practice. This is what you're expected to do as a therapist, assess the level of risk. So if you fail to conduct a risk assessment, for example, and to document that you did that assessment, that would be a major error, because whether or not you did it, your documentation doesn't show that you did, and that is against standard of practice. So there's that piece. Now, the second piece, reasonable care, once you've made the assessment and you've determined what the best course of action is, it's important to document that appropriate precautions were taken in order to reasonably prevent a client's suicide. So if you do the assessment and you determine that there is a risk, but perhaps it's not risk enough to warrant hospitalization, for example, then you would need to document in your record what you did as far as safety planning goes after the assessment. So you can see that there's the two pieces there. One, you assessed, you did what you needed to do to figure out what exactly is going on. And then second, you intervened in an appropriate way. And both of these things need to be documented, because that documentation serves as your proof that you did what you needed to do. You tried your best within the limits of what you can do as a therapist to prevent this person's suicide. So common complaints that are lodged against mental health providers involve sexual or romantic interactions with clients' partners, or clients' family members, failure to failure to practice within the boundaries of competence. So if you remember, competence has to do with what you're trained in. So if you're not trained in a certain mental health issue, but then you attempt to provide therapy for that person anyway, and then harm comes to them, that could be a malpractice suit. Improper sharing of confidential material without client consent or legal justification. Remember, when releasing records, you need a release of information. And if you're subpoenaed by the courts, you need to assert privilege except for certain circumstances. Failing to make your fees and charges clear along with informed consent. Misrepresenting yourself using false advertising. So saying that you're licensed when you're not, saying that you have a PhD in clinical psychology when you don't. All of those things are potential malpractice suits. Altering records, like crossing things out, and then practicing while impaired are all problematic. So how do you avoid these? With sexual misconduct, you can avoid it by not having sex with your clients or anyone they're related to or friends with, but also with setting boundaries early and consistently, yes. Make sure that the client knows who you are as a therapist and what your role is, that your role is to provide therapy, not to be their best friend or their partner. With competence, get training so you can expand your competence, and use referrals. When you know that you're not competent in a particular area, refer the client to someone who is. With confidentiality, I already mentioned, use ROIs. Your fees and charges should be provided in the informed consent document. Credentials and advertising include your title and, if you have it, a registration or license number. So in anything that you publish or have your name on that has to do with therapy, you all should be writing MFT trainee. For records, we never use whiteout. If you have to change a record on a paper chart, you would cross it out and use your initials. If you're using an electronic chart, you would do an addendum, and you'll learn how to do that at your site. With impairment, we want to make sure that we're taking care of ourselves and monitoring ourselves to avoid things like burnout and compassion fatigue. And then consent. Even though written consent might not be required legally in most cases, it is wise to have your clients sign the consent. It's best practice. So these are some ways that you can avoid malpractice suits. So sexual misconduct is its own thing and is taken obviously really, really seriously. So we're gonna break it down a bit. So sex with current clients, definitely not okay. Any sexual conduct between a therapist and a current client is both unethical and illegal in the state of California. Professional therapy never includes sex or any form of sexual advances or behavior. That includes verbal advances, flirting, contact behavior of any sexual kind. Totally not okay. You can totally lose your license for that. Don't do it, ever. Okay. This next slide here is about a different therapist, so not you, having sex with a client and what you do. So here are a couple scenarios. In the first one, if a client of yours, your client, informs you that they had sexual relations with a previous therapist, again, not you, what do you do? So in this case, you're going to provide them with a pamphlet called Professional Therapy Never Includes Sex. This is available on Canvas for you and was one of your assigned readings. Okay. If you see a question like this on an exam asking about your client telling you they had sex with a previous therapist, you want to include the pamphlet. Professional therapy never includes sex. Not doing so, not giving them this pamphlet is considered unprofessional conduct, because this pamphlet gives them information about what happened and how it's not okay and what they can do about it if they choose to. Please note, you cannot take action on this behavior by reporting it to the board, because this would be breaking your client's confidentiality. The client told you in a confidential therapeutic situation, so you cannot report it and break their confidentiality. And similarly, you're not going to force or coerce your client into making a report with the BBS if they don't want to. Okay. After you give them the brochure, you don't want to pick answers that say that you're then going to go and report it, or that you're going to confront the other therapist, or you're going to talk about it with your colleagues. No, it's confidential. Okay. So after you give them the brochure, the next logical step is going to be discussing it with the client, letting them know what their options are without making them feel forced to go in a certain direction. Okay. Now, this does change a little bit if it was a minor. Remember, a minor is a protected population, and normally we make mandated reports when we see issues going on with minors. So that's kind of what's going to happen here. If you have a client who's a minor and they inform you that they had sexual relations with a previous therapist, this is considered a child abuse report, whether or not it was consensual, because they're a minor. So in this case, you're not going to hold confidentiality. You're going to call CPS and follow the normal steps to make a child abuse report. You would still not confront the other therapist or do anything like that. You would call CPS. Note that this doesn't say you call the BBS and report them. That's still breaking confidentiality. You call CPS, okay? If it was an elderly client, remember, who's also a protected population, and they tell you that they had sexual relations with a previous therapist, as long as it was consensual, we maintain confidentiality. This is consensual sex, they're consenting adults, it's okay. In terms of the law, it's not appropriate, but we would not break confidentiality. That would get us into trouble. Now, if they tell you that it was not consensual, because they're elders, this would count as sexual abuse and we would report it to APS. Okay. Now, with all of these situations, I do want to make it really clear that what the therapist did by having sex or sexual relations with their current client, that was illegal and that was unethical, okay? But what this is talking about is our behavior as a therapist in handling this information, okay? I hope that distinction is clear. Okay, now what about sex with former clients? So let's say you, for example, are attracted to your client, you're no longer seeing them as a client, because remember, that's never okay, and you're interested in engaging in a sexual relationship with them once you've terminated. So the rules are a bit different based on where you look. So according to AMPT, sexual intimacy with former clients or known members of clients' families is prohibited completely. It doesn't matter how long it's been since they were your client, it's prohibited, okay? According to ACA, it's prohibited for 5 years post-termination. So you terminate, you gotta wait 5 years, and then you can technically, ethically engage in these relationships. And according to CAMPT, it's prohibited for 2 years post-termination. I personally strongly encourage you to follow the most restrictive rules here, which come from AMPT, and not ever have sex with a former client. There's a really strange power dynamic there and a lot of potential for exploitation. It's really slippery there. And you bear the burden of demonstrating that there's no exploitation. So if ever your license is called into question because of this behavior, you have to prove that you're not harming this former client of yours by engaging in this relationship with these really skewed power dynamics. And if they rule against you, you can lose your license. So really not a good idea. Okay, sexual relationship warning signs or red flags. These are some red flags to watch out for in your own practice, as well as potentially with colleagues that may be heading toward this inappropriate, unethical, illegal behavior of sexual relationships with clients. First, telling sexual jokes or stories within session is never appropriate. Second, discussing your own sex life or your relationships excessively with no benefit to the client, almost as a means of flirting, not a good idea, definitely inappropriate. Not respecting body boundaries, so sitting too close to a client, initiating hugging of a client, holding the client, all of those kinds of things that really cross boundaries, not okay. Inviting the client to social engagements like lunch, dinner, your birthday party, again, is crossing boundaries. It's making it very confusing for the client to keep you in your lane as therapist. And then finally, changing business practices. For example, are you scheduling late appointments for this client only because no one else is around and you have more privacy? Those kind of sketchy things that you're starting to do, special treatment type stuff, not a good idea. Avoid it. What are the penalties for unprofessional conduct? You can be charged with a misdemeanor. If it's sexual misconduct, you can be charged with a felony, because of course that's a bigger offense. You may have to do jail time or be fined quite a bit of money. You can receive an injunction or a restraining order, and you may have penalties to your license, like having it placed on probation, suspended, or fully revoked. And that would be something you'd have to report if you move to another state and try to get a license there, which could very well keep you from getting licensed there as well. It's really a big deal. You really want to avoid it. So here's an example of how this might come up on an exam. Okay, so a 16-year-old client informs the therapist that her past therapist touched her inappropriately in a sexual manner when processing past trauma. What should the therapist do? So let me draw your attention really quickly to a couple things here. One, the age of the client, 16. So we're dealing with a minor. This already heightens the stakes a little bit. And this is clearly asking about potential sexual misconduct when processing trauma. Okay, so that should get you in the right mindset. Our answers: A, provide her with a pamphlet, professional therapy never includes sex. B, make a child abuse report. C, inform the client's mother about the incident. Or D, maintain confidentiality. So take a minute, think about what you've learned so far, and then we'll discuss. Okay, so answer A would be a great answer if this was not a minor, but because it's a minor, there's something more important than providing this pamphlet. So I'm going to jump down to B, which is the correct answer. In this case, because she's 16 and had sex with sex with her therapist, remember that this is considered sexual abuse and is reportable to CPS. And that mandated report supersedes giving the pamphlet. So you want to indicate that you know this is the most important thing to do first. Okay, you'd make the child abuse report, then you could provide her with the pamphlet and discuss options. Answer C is definitely not okay because it's a breach of confidentiality to inform the mom. Could you do that at some point? Yes, but again, the best answer is B and then probably A. If you wanted to inform mom, you would potentially have to get a release of information from the client. Of course, it depends on who signed the consent form and so on. But here they're really trying to make sure you know that this is a child abuse report. And D doesn't really address anything, so not a good answer. Okay, next one. Another example. Your new client shares that he is a therapist. He discloses that he recently had an affair with a client, but ended it because he knew it was wrong. He indicates feelings of guilt and remorse. How should the therapist proceed considering the legal and ethical issues in this case? This is a bit of a complex one, so just to make sure you understand the question, you have a client and your client happens to also be a therapist, and your therapist client has informed you that he had an affair with his own client and then ended it. Okay, so here are our answer choices. A, explore his feelings of guilt and remorse. B, provide him with a brochure, professional therapy never includes sex. C, encourage him to file a report with the BBS. Or D, find out if this has happened with other clients. So take a moment. Okay, so this is an interesting one because the person who's engaged in the sexual misconduct is your client. And so you're kind of having to balance some confidentiality issues with what you know about misconduct and sexual misconduct and the fact that this is your client and all of these really complicated issues. So this might be a hard one. We're going to actually start at the bottom here with D. Find out if this has happened with other clients. This one really isn't the best answer because remember, the question is asking you about the legal and ethical issues in the case. This kind of looks almost like an investigation that you're trying to engage in and really just wouldn't be best. C, encourage him to file a report with the BBS. This would not be in the best interest of your client. This involves him reporting himself to the BBS, which would likely result in him losing his license. So not okay, not in the best interest of your client. Remember, this is your client. B, providing with a brochure. This is done, so providing the brochure is done when a client reveals that they had sexual relations with a therapist, but in this case, this is the therapist that's done it, and so this would not apply at all. So the answer here is A. There's really no obligation to report this or to investigate it. You are there, and your primary concern is to be this person's therapist and to help him process what he's done. If it helps, you can kind of think about this with the way you would treat it if a client reported to you that they committed a crime, right? Even though everything inside of you and your professional values and your personal values may be telling you this needs to be reported, this is wrong, you have to remember that you are the therapist in this case, and you need to protect the best interests of your client. And in this case, it's helping him process what happened. Right. So that's it for this lesson. Let me know if you have questions. This is a complicated one, so we'll get to discuss it some more during our live Zoom call. Thanks, everybody.